The Ghana Association of Medical Laboratory Scientists have warned of imminent drug shortage at hospitals after Pharmaceutical Importers and Wholesalers Association of Ghana halted supply on credit to regional medical stores.
The position of the Pharmaceutical Importers, Producers and Manufacturers Association, what they are suggesting that they will be doing will have a devastating effect on our health and the health of everybody in this country. Let's not take this lightly. At this moment, they are saying that cash and carry, no credit to the facilities and anybody who buys drugs from them on wholesale. What that means is that the facilities, private and public, cannot also give the drugs to you on credit. And how do we give the drugs to patients on credit? We give the drugs to patients on credit when they come with the various insurances, either health, the public national health insurance or the various private health insurances. Each of these, when a patient presents to a public or private facility with these insurance, they are treated, serve medications, and the insurance will pay sometimes 3 months, 6 months, 9 months later. Now, if the hospital cannot get the drugs on credit and has to pay upfront, it means that this has to be passed on to the patients to pay upfront. Then the essence of all our health insurance system is lost. It's the reason why we are saying government needs to quickly see how they can find innovative ways to prevent collapse of the health insurance system, because access to health care is going to be threatened seriously if this is carried through. I think the Manufacturers Association themselves made some recommendations which look very plausible, which I think government can consider, because we are having a global economic situation. The country is going through some economic difficulty, but can government sit down and look at what can we do to protect some vital sectors of the economy? And one of them is...
Right, so President of Ghana Association of Medical Laboratory Scientists, Dr. Abudu Ramani, joins me on the telephone lines for a conversation on the back of this. Doc, good evening. Welcome to Newsnight. Can you say that we're heading to a cash and carry system looking at all the things happening?
Good evening to all your listeners. May I say that we are definitely heading towards that direction, looking what is happening on the ground. It's quite serious, but it looks as if no one is seeing the danger ahead of us. And as usual, we wouldn't be saying anything until it hits us very hard. It's important for us to note that the decision by the Chamber of Pharmacy in this direction is something that needs to be worked on and act on it immediately to avoid any serious consequences going forward.
Right. Are there signs of drug shortage in the regional stores and the various hospitals?
Yes, you get some of the pharmacy shops indicating, for example, a colleague who is a pharmacist tells me that they cannot stock enough of their medicine, so you have to buy based on cash and carry. Unlike those days where they can give it to you 3-4 months for you to be able to pay back. Concerning the medical stores, some of them, some of them can owe institutions for almost like 6 months, 1 year, and to 2 years. All right. So it is making the availability of certain medication quite expensive, and let me say, even its availability is also under some consideration now. And so things are not rosy at all on the ground, even though people are not bringing it up. But colleagues will tell you that things are not easy, because hitherto they could stock as many and as much medication as possible. Now you just have to buy based on what amount you have. And you know the funny thing that happens, you buy today, possibly maybe some in 50 you buy at 6 cedis. By the time you finish selling it, you go to buy again and just move to 10 cedis. All right. So this is a major issue which really needs to be looked at.
Right. And what, in your opinion, do you think government can do to prevent this catastrophe from happening?
Well, there's a need for government to look at it very carefully, because you see, this, we are just looking at the pharmaceutical industry, but don't forget that the hospital is a complete system. There are other consumables, there are other things, the laboratory reagents, and they all face a similar process. I can just not imagine if today we get to hear that the laboratory suppliers also decide that they are also going to do cash and carry.
Right.
It's going to be a very serious thing. Okay.
Right.
Now, there is the need for government to take certain steps, which are very, very important. One is the fact that the health insurance payment system must be very, let's say they have to pay on time. Okay. They have to pay on time,
right,
in order for the the hospitals and the regions to get enough resources or cash to buy. Because certainly the suppliers are not going to be in a situation of giving you anything within 3, 4, 5 months, which they used to do. Other than that, things will go haywire. Right. Now, the other thing too is that just recently, it was funny because in July, the National Health Insurance increased the tariff, okay, only for them to reduce it in October again. It is something that the National Health Insurance has to look at. In reality, the tariff they are giving now wouldn't match. It wouldn't pay anything. Okay. And here's the case where institutions are also doing some form of co-payment in order for them to survive. They say co-payment is not allowed. So what exactly is it that the health insurance is trying to tell the institutions that they should go down the drain and collapse? There is a need for them to look at the tariff once again. You increase it in July and then reduce it again in October.
Right.
Then what signal are you sending? There's also the need for government to also look at, these are most of the medications and most of the things that are bought are imported. Okay. They are imported. So if they are imported, there are clearing systems that goes on at the port. There's the need for government to establish some kind of system that will help them. Okay. In order to cut the cost of everything. Because you see, we are today speaking about the issue of the pharmacies, okay, and medications. And we have also forgotten that tests has to be carried out. Diagnostic system has to be done. X-rays, physiotherapies, laboratory services. All of these institutions, suppliers also feed into the system. So this is just one leg of the whole issue. Now, I believe that if the laboratory and other diagnostics also come in place, then there is going to be a total chaos in the health sector. And for me, it's a very important topic you brought on board for us to discuss. And we need to really look at it passionately, and government must pay attention and try and find ways and means to support the suppliers, because things are getting out of hand.
Right.
Prices are changing daily. And hospitals that have put placement, let me give you a typical example. There are institutions that have put in placement at hospitals, okay, where certain prices have been picked. But I have to supply you with the reagents and other things at a price I bought maybe 2-3 months ago, when the dollar was a specific amount. Now things have gone haywire. Do I come back to the hospital and say, increase the price for me? How are the hospitals going to get the resources to manage all these things?
Right.
It's a dire situation, and there is the need for government to pay attention and then come in and support. Maybe take something for, the medical field, all right, so that any person involved in medical supplies is at least pushing a little bit, so that when I import the thing and I bring it into the country, at least from the port, the clearing system and other things, government has some sort of subsidy for me, which will help me to push in all the things, so that I do not bring it all and put it or heap it on the facilities.
Right. Dr. Ramani, I'd like to thank you very much for your time this evening.
Thank you.